Hello, and welcome to this exciting episode of the Wonder Tooth podcast. Welcome to my channel. I am Dr. Saad. So first, before I get going into this exciting episode of how can you choose your dentist, I'm going to share a code with you today to get a complimentary consultation for implant dentistry or for cosmetic dentistry or for whitening. And the code is going to be today DENT, DENT 48. Don't forget about this one. So if you like this episode, make sure to subscribe, like, and share with your friends, and turn the notifications on so that you can get more knowledge about, the dental world and how you can take care of your teeth. And I'm gonna tell you a little bit about myself. My name is Dr. Saad. I am a practicing dentist in New Jersey. In Princeton, New Jersey. I have over 20 years of experience, and I'm also licensed to practice in Canada. I actually practice there as well. So, plus I am also the past president of the Mercer Dental Society, which is part of the New Jersey Dental Association and the American Dental Association. I also hold a position in the executive board of the Mercer Dental Society as well. So I've been doing a lot of dentistry, basically. I think I can give you a quick, hint here or there about how to choose your dentist. Of course, it's very important to know what you're looking for. Can you believe that over 80% of the patients or the people in general, they don't really like their dentist? I get a lot of them in the office and they're like, my dentist, something happened and I don't want to go back. And sometimes I'll be like, well, you had some work done, you need to go back, and then they need to revisit that or fix it for you. They're like, no, we don't want to go back. So things like this, or the dentist retired, or moved out of the state. Anything can happen. And just to give you a quick heads up, I am also the owner of Dom Blanche Dental. We are in Princeton, New Jersey. If you ever need second opinion, we are located on 3640 Lawrenceville Road in Princeton, New Jersey. You can't really miss it. It's a big practice. Beautiful practice though. And I'm the only dentist there. So let's go back and talk about how you can select the dentist. So first of all is going to be, you really have to look at the credibility, the credentials. You have to look at the qualifications, because if you heard of that, one of my episodes about the veneer tech, where people actually were lured into getting veneer work done, cosmetic dentistry, from people who are not even dentists. They didn't even go to dental school. So I don't even understand how that happened, but it's still happening, and I'm really trying to raise awareness against this. So the first thing you guys need to really look into, find their credentials. You can really easily do that by checking on their website. If they have a DMD, which is Doctor of Dental Medicine, which that's the one I have, or a DDS, which is Doctor of Dental Surgery. Pretty much they're the same. It's just depending on which school dental school you graduated from. This is very important. And also you can look on their website and see if they are affiliated, or they are members of, big associations like the American Dental Associations if you are in the US, Canadian Dental Association, and also the state dental associations too. Like, here we are in New Jersey, there is New York, Pennsylvania. You have to look into that. Plus, you also need to look into, for example, let's say you want to get an implant. You have to look for somebody who is working or who got certified also to do that for you. Don't go to anybody who just fresh out of school, they didn't put any implant, and then you're going to be the guinea pig. You have to really think about that. So for example, the ICOI, which is a very reputable organization for implant dentistry. There is also there is a lot of associations, but you have to make sure that they are at least work with them, members with them, because that would mean that they are doing a lot of continuing education, which is very important. You want to go to a dentist who knows what they're doing, and they're also up, to the new the new technology. Don't go to it. I mean, I can't really say that, but if you go to somebody who's like 70 years old, 80 years old, they're not gonna really do a lot of technology unless you've been going there for the best part of your life. I cannot say anything. So very important that you are going to look at the credentials, the qualifications, very important. Then what comes next is going to be the experience. Do they have enough experience to handle your dental care? Because I get a lot of patients who actually been misdiagnosed. And I mean, they were treated wrongly for something else. And how can I find out when they bring the x-rays from before and then we compare with the x-rays in their mouth like right now? So this is not okay. For example, I had a patient actually last week. She had bunch of smile makeover, top teeth, bottom teeth. They did a root canal in every single tooth. And that was done overseas. And right now her whole smile makeover is failing. And I'm like, why did you even need a root canal in every tooth? They told her she needed to get a root canal in every single tooth before they can do cosmetic dentistry on her. And this is not okay. This is not okay. It's impossible that you're telling me that you're gonna put a root canal in every single tooth. She did 10 teeth on the top, 10 teeth on the bottom. They did a root canal on every single tooth. So if the dentist tells you that, just run away. Walk out and say, thank you very much. See you later. Don't ever go back. So it's very important you go to a dentist with experience because they can really help you. They've been through a lot, they've seen a lot. And one of actually the cases that I have seen, or one of the patients, he didn't even know what was going on. He thought he had a brain problem, like a brain problem. And he came to me in excruciating pain, severe pain. It was on the bottom left side. And I said, what's happening? He had a swelling and he's like, I went to my dentist. They didn't know what was going on. I went to my medical doctor. They sent me to a neurologist. They did a brain MRI. They did this, they did that. And I have pain and I have a swelling and I don't know what. And now he's thinking, okay, cancer is going on. Something big problem is happening. And I said, let me take a little x-ray. He said, I gag. So we really tried to take, the small digital x-ray and he couldn't do it. So I said, hold on, let me just take a look. So I have a big x-ray in my office that it's really a panoramic, but it changes into a cone beam, which is like a CAT scan. We took a little x-ray basically on both sides of his jaws and I'm looking and I said, well, you have an infection. And he goes, what? What do you mean? Because they tried to take small x-rays. His roots are very long. They couldn't see the bottom part of the roots. So now the poor guy had an infection underneath it and nobody could tell. And that's why he had an infection. However, the tooth, he had no cavity in the tooth. There is no old filling in the tooth. It's a virgin tooth, but he grinds a little too hard. So what happened, because I have that 3D x-ray, micro cracks started to happen in the tooth. The nerve started to die. The nerve died completely. And now he ended up with an infection underneath it and nobody could tell because they didn't take the proper x-ray. Came to me and I said, well, you have an infection. We need to do a root canal. Thank goodness his crack was not all the way down. And I can see that with this 3D x-ray that we have. So we ended up doing a root canal, did a crown. He was a happy camper and misdiagnosed. He was misdiagnosed. So this is very important. Experience is very important. And also at this point, technology is also very important because did you just hear what I just said about, okay, a small x-ray is completely different than a big x-ray and sometimes completely different than a 3D, the 3D scan. So a small x-ray can show a little bit, but the panoramic is also can shows a little bit more, but then the 3-dimensional x-ray, it literally shows me everything. I can literally go inside, I'm like inside the bone. I can check where the vital structures are. I can see that. And I usually use it if we're doing like an implant placement or we're doing a root canal, just to make sure we have everything covered. And we can see where the vital structures are. We can actually see if there is like a broken part of the tooth or, a crack in the tooth, if the crack is all the way down or if it's just initial on the top part of the tooth, because the treatment is going to be completely different. If you have, like, let's say you grind very hard, you're not wearing your night guard, you crack part of it, you bite like a popcorn or a whole almond and you crack part of the tooth. So depending on where the crack is, it completely changes the dynamics, how we're going to treat that tooth. So this is very important. Technology, if they are using technology in their office, if you're going to a dentist and they are still, taking those very old x-rays that we basically have to put the x-ray in like a little machine with solutions. This is very old, guys. This is 20, 30 years old now. You deserve to take care of your body, and to basically, the technology is out there to help you. So technology is very, very important. Digital dentistry also is very important. So for example, we're pretty much everybody really, let's say you need a crown, or you need a filling, or you need a bridge, and you go to the dentist. You need a crown. Let me bring you, we're gonna, shave the tooth, and then I'm gonna take that mold with the gooey material, I'm gonna send it to the lab, we're gonna put a temporary crown, and then you come back in 3 weeks and the crown doesn't fit, or the color is off. Okay, let me put the temporary back on after I take another gooey stuff, especially if you gag, that's a big problem, and then send it again to the, so here you go, you are here waiting for 6 weeks, 3 to 6 weeks without a tooth, just a temporary. Now you're biting something hard, you're chewing like a gum or something, the temporary comes off, you keep going back to the dentist, you're frustrated. The dentist is also upset because, okay, what am I gonna do at this point? I need to put the permanent crown. So in our office, we changed the whole dynamics because we are completely, totally digital. And I mean, we have 3D scanners, we have 3D milling machines, we have 3D printers. So let's say I need a crown, I need a cap. You come to me, okay, yes, you need a crown. Can I get it done now? Absolutely. Yes, we'll do it right away when you're sitting in the chair. And the people were like, oh, and I'm going to come back and I say, no, you're going to finish the whole treatment right now. And they look at me now, I have 3 heads because I'm talking like nonsense. You're like, you're going to put a temporary right now? No, I'm going to put the permanent tooth. How is that possible? Well, it's possible because of CAD/CAM technology, which is computer-aided design, computer-aided manufacturing. And that's what we use. I've been using this for over 10 years already in my office. So how do we do that? Let's say, okay, I need a crown now, or my veneer broke, I need to match it. Oh my God, what do I do? And I've seen this so many times. I've experienced that so many times. And thank goodness we were able to help a lot of patients with this. I'm traveling tomorrow. My tooth broke. What do I do? I'm going to be overseas for 2 weeks. Sit down and basically we numb the patient. We take care of this. Basically, after we shave the tooth, we have that little scanner. It looks like a little camera. We scan the teeth, and I've been doing this for so long. So I just designed the crown or the veneer or even the bridge or the implant crown on the spot. And then the machines talk to each other. I have in the other room, actually right next to it, the 3D milling machine. So they talk to each other, and basically the other machine has drills, and we put like a porcelain block and it starts to shave it. It's incredible. People, they wait and they're like, I can't believe it's milling it in like 10 minutes. I said, yeah, or 15 minutes, sure. And then after that, if it's a front tooth, we need to do a little bit of staining or glazing. We put it in the oven. It's done. It's in the patient mouth, bite adjusted, an hour and a half, and you're done. So it's very important for you guys to really go to a dental office where they are using technology, because it's going to save you time, it's going to save you energy, and it's going to save you gas too, like go driving back and forth to get that, taken care of, especially if you gag. That's a big one, because gagging, it's very, unfortunately, it's very common to happen when you are, they're doing the gooey stuff, the mold. But with the scanner, it's really nothing. It's just open your mouth and it doesn't even touch your teeth. So this is very important. If you gag, or if you have an anxiety, from which, as I understand, because, you don't want too many things in your mouth at once. So the scanner, 3D scanner, it's phenomenal. It works like magic, and the fit is incredible of whatever crown or bridge. Is just, it kind of really like drops onto the teeth. I barely do some adjustment. So we spoke today about how you can, choose the right dentist for you. So we spoke about, it's very important to check their credentials and to make sure they have the proper qualifications, and also that they have proper experience. If you need to go to a dentist, you want to be there for 10, 20, 30 years, you need to go to an experienced dentist. And also the technology. Now, it's very important because how are you going to find all of this? Ask your friends, ask your neighbors. Oh, by the way, where do you go? Facebook also has a lot of recommendations right now. So a lot of, people, they go on Facebook and ask, I need to go to a dentist, a good dentist. And then, the people, they will put like a whole bunch of names, and then you have to do your due diligence now at this point and go check every one of them. Check their website, check the reviews. Even sometimes some of the offices, they have on the website like how the office looks like, and then you can see the dentist, how they're doing work, the staff, how the office inside looks like. But I really think a very important part is you go in person. Like, let's say, you know what, I'm between those two dentists. I don't know which one to choose. Just do yourself a diligence, drive to the office and say, I want to make an appointment. Go check the office first before you actually make an appointment. If you are still, especially if you're anxious and you want to make sure everything is going to be okay, just go double check, the cleanliness, if things look organized, if the staff are friendly, if they're happy, or if they're gloomy, I don't want to talk to you, and the office is like messy. You have to really check this for yourself too. So recommendations and also online reviews is very important too, or testimonials. Of course, you're gonna find like maybe 5 good reviews, you're gonna find one that's like, but you have to read the reviews and you have to see if they are consistent too. It's not like, they have 5 stars out of 5 stars, but the reviews were like done 4 years ago. It doesn't really, or if the reviews are actually put with anonymous name too, that's a little fishy. So you have to look into that. Make sure that the reviews are, consistent and they are somehow like newer, like, last month, couple months ago, last 2 weeks, something. Yeah. But the best thing is really recommendation. We get a lot of patients really from word of mouth. Friends, oh my God, I love this place. So they send us their friends and they send their families and they say, oh, I came today, it's my first visit. My husband is coming next week because I love the place. Oh, sure, of course. So this is very important, okay? Like basically when you want to go buy something like a couch, you go check. I do it myself. I go and I read the reviews. If it's nice, if it's comfortable or what's going on, I check reviews too. So we spoke about those important steps. And then of course you have to check, the communication, how the communication is going to work with the dental office. Let's say you have some x-rays from another office, so you want to make sure that the new office is getting the x-rays. You have to ask all about this, they should have like a form, it's called like the record release. So basically you sign the form, they can get all the information from the previous dentist. And basically, I think we covered pretty much a lot of stuff. Oh, you also have to ask them about some payment plans, options, or if they take your insurance or if they don't. Some of the offices, if they don't take your insurance, they will still be considered out of network and they can still take your insurance. It's a little tricky, I know, but for example, if you're getting a cleaning, your cleaning, depending on your plan, should be covered by your insurance, even if the office is out of network. So you have to just ask all about this. If you want to get cosmetic dentistry, veneers, or smile makeover, most likely it will not be covered by insurance, but you have to talk to the office and make sure that both of you are on the same page. Just to clarify things from the beginning, because it makes a whole lot of sense, makes things, very easy after that. So we touched base about few things, and I hope, that's gonna help you to choose your right dentist to take care of your teeth and your health, your dental health, because it is very important. Yes, they are teeth, but they're also linked to your whole body. And we need to make sure that your teeth are going to be there until, forever, basically. I hope it was informative today, and if you need any second opinion, I would be more than happy to help you and assist you with this. Just make sure you give me, in the notes or in the comments, tell me about your experience. Tell me about how your dental experience was with your office at this point. Are you happy or you're not happy? How, we can maybe help you out to choose the right dentist for you after this episode. And we're here if you need any second opinion. Sometimes I get patients, you know, my crown doesn't feel right, and I look and I say, yes, something is going on. I would even take the x-ray and I'll tell them what exactly needs to be done, and I'll be like, go back to your dentist, they need to fix it. And they do, and everybody's happy at this point. So I hope it was informative enough, and don't forget, take care of your teeth so that they can take care of you. Until then, keep smiling with Dr. Saad. Have a good one, everybody.